My name is Kit Liu. I am the Director for Clinical Trials Research Program for UPMC Hillman Cancer Center in Central PA. I'm also the co-director for the Breast Medical Oncology Program. Each patient's treatment journey is different. They have a unique story and unique lives that are behind the journey against their fight with cancer. This can be impacted by their work life, their family life, and so many other factors that drives them and motivates them. In terms of our promise, we promise as their physicians to give them the utmost top quality care, evidence-based, innovative care close to home. But I think what is more important is also be mindful of their journey and of their story. Come up with a comprehensive treatment plan that factors in all of their other factors in addition to medical treatment so that we can come up with a comprehensive treatment plan. Many of my patients struggle with different parts of their treatment journey based on cause. So from the initial diagnosis of cancer, a lot of my patients are automatically thinking, how is this cancer going to impact my work, my life, and my finances? Not only afford the treatment, but how are they going to afford to live? They're struggling with hair loss, they're struggling with fertility, and these are some of the out-of-pocket costs that they have to incur as they're going through their treatment. So, they're impacted by that as well. And then I think finally, even when they're finished with their treatment, they're often worried about the continued cost of their care. They still have to come back for their follow-ups and their treatments, and many of them are struggling with long-term side effects of their treatments, such as neuropathy and hot flashes, for example, and they have to go through additional care even though they're done, quote unquote, done with their cancer treatments. I think that integrative services are so important for our patients, and so having supportive treatments like nutrition, wellness, acupuncture, massage, and yoga, they have all been demonstrated scientifically to improve their side effects. And so it is so important to have these additional support for those patients so that they can live with their disease and live with their side effects. With genetic counseling, it's so important for our patients because even before they're diagnosed, knowing about their genetic risk can impact screening, can impact their understanding for their risk of cancer. So understanding their genetic risk can lead to saving lives, can help their additional family members to understand what their risks for their cancers are. When someone's diagnosed with breast cancer, getting that genetic testing is also very important because sometimes it impacts our treatment decisions and it impacts their survival. There are many drugs now that are approved due to the genetic risk and due to the genetic mutations. So knowing that helps the medical doctors decide on their treatment. The Fund for Clinical Excellence is so important for us to continue to create innovative treatment for our patients. Oncology is constantly evolving. The cancer research helps us stay up front and stay ahead of the cancer treatments. And it helps us give our patients the top quality, most advanced clinical care for our patients. And unfortunately, there are a subset of our patients, due to their insurance, they cannot participate in clinical trials. I would thank you from the bottom of my heart. Your donation, your generous donation, would save lives here and impacts the lives of so many who are undergoing treatment for their cancer. It's not just treating their cancer, but you're impacting their daily lives, their work lives, their social lives, their family life. And then you're also, with your generous donation, you're also helping medical doctors advance their care so that we can better take care of our patients.